Morning, everyone. Hello. So we're going to be discussing Rishi Sunak. He said a few things yesterday that I can be picking at, but I'm going to particularly pick on his blaming of doctors this time, junior and senior doctors, for the fact that he won't be able to do much about NHS waiting lists. Now, I'm going to pick on, there's a couple of statements right from the bat in the comments. I don't normally do this right at the start, but I'm going to because it's very relevant. So Plumduff's saying that, morning, I see the Tories are telling the over 50s to get on their bicycles and work delivering food. Tell that to my damaged lungs. What I will say about that, because this is very much about the theme of the Tories are now basically blaming everyone for everything. Now, it is quite normal for the Conservatives to blame others, usually small groups who don't really impact the elections anyway. And so, for example, when it comes to like work, they make a big deal of, oh, the young these days, they're all work shy. They don't know the meaning of hard graft. They're all whining. And that works. And that's worked for centuries, by the way. You can find examples of this going back 200 years where the people with the power, back then hardly anyone got a vote at all. But for those who did, yeah, they absolutely would blame the young for it, and we do it now, and it sort of works for them because the young don't vote in large numbers. But now the Conservatives are actually blaming, if they're blaming people in their 50s, and they're actually attacking groups who do vote in large numbers and where there's a lot of swing voters as well. Absolutely incredible. But and then Ray Harvey said there, complete this sentence, Sunak blames blah 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 blah. Everyone at this point, isn't it? It's everyone but him. Everyone but him. Because I'll tell you something else on the waiting list, right? Let's say when he made these 5 pledges at the start of this year, he thought he was going to achieve them. Quite how, I don't know, but he thought he was going to achieve them, right? He thought they would just naturally happen without him doing anything to help them, okay? Now that's not the case, and he's getting a bit angry about it. So now he's blaming doctors. Now, let's have a look at it. Let's just have a look at waiting lists and how it's actually worked out. So these are the waiting lists. Now, I'm going to explain this. These are the waiting lists ever since the NHS was first formed, right? Now, obviously, the population grows, so there's going to be a natural bit of inflation anyway. And you can see there's different colours for the different phases. That's because waiting lists have been measured in different ways, okay? So if I go through, we'll ignore the first few decades because that's neither the Conservatives nor Labour in their current formation, right? So if we head towards the 80s, so the Conservatives decided to measure inpatient and day cases reported quarterly. So we can see that while so this is the bit between 1987 and 1997, okay? Inpatient and day cases reported quarterly. So you can see they increased over time while the Conservatives were in power, all right? Now, again, I haven't actually gone back and looked at the maths on it to see if that is just, if per capita it sort of stayed the same, because I'm not having a pop here at the last Conservative government, but the current one, right? But what you can see is in 1997, the Labour government said, no, we're going to actually do this properly. We'll be reporting monthly, right? Monthly, not quarterly, monthly, right? And then what you can see is after initial increase when they came to power, because of course they're still using the Tory budget for the first year, basically, then it came down, and it came down sharply. So they got it right down below 1 million. And then in 2004, Labour said, right, we're going to have all of this now. We're going to have inpatient day cases and outpatients. So this is like everyone who's now in the NHS treatment system, right? So they're going to say, we're not just going to have it for inpatients and day cases. No, this is all inpatients, day cases, and all outpatients, right? Everyone in the treatment zone, shall we say. So again, this is the darker blue bit. And again, once they decided to target that, came down quickly, came down rapidly, okay? Then they said, right, We're bringing this right down now. So now we're going to do it for everyone. So the last thing, the purple bit, which the Tories haven't changed for some reason, Labour said at the time, right, we're going to now include everyone from 18 weeks from referral for a GP for treatment. That way, because obviously, you know, when you're just doing inpatients, day cases and outpatients, you're just talking about the people who are already getting hospital treatment. But what if there's anyone who's been referred for treatment but not getting it? So their GP has referred to them, but they're not getting it. They're stuck in the system. So Labour says, right, we're going to make sure those are part of it as well. So make sure people are focused on that target. So they're saying you've got 18 weeks. After 18 weeks of being referred, we expect treatment to be started. Again, came down sharply. All right. Then bit of up and down because of the banking crisis. Then the Conservatives came to power. And ever since then, up and down, but it has been just up. Right? Cleared the banking crisis. So we should have been able to make an economic recovery. We should have been reinvesting in the NHS as well as other public services. But the waiting list kept going up and up and up and up and up. And here's the thing. Rishi Sunak is saying the reason I can't deal with NHS waiting lists, even though I promised to, is because of the doctors striking. Now, there's two things to say about that. The first, of course, is that he knew that doctors would be striking when he made that promise, unless he offered them an above inflation-linked pay rise, right? And he hasn't done that. In fact, I'll read out what Rishi Sunak has said. He's basically blamed doctors. He said it's the fault of doctors for not accepting pay cuts. He said not accepting the pay deal, but the pay deal is for pay cuts. And I want to point out a couple of things as well, before I point out the other reason why Sunak's got no reason to complain. The reason why these strikes are happening, it's not because they've had a below inflation linked pay rise, right? Because people sort of understand every now and then recessionary pressures, even if you're not in a recession, you have a sort of recessionary period where the economy's struggling, right? Which means tax revenues are struggling. We get that. We can look at it and we can say, well, if we had a different economic model where we didn't let the rich get away with tax, you know, if we taxed the rich a bit more, we could still pay for it. But, you know, people sort of understand the way people expect the economy to run is every 10 or 15 years, you'll have one of these periods, these inflationary periods for a couple of years. And people sort of understand that your real terms pay is probably going to go down. But they expect after that couple of years to be back on top, and then they start getting above inflation-linked pay rises again. They expect to get the pay rises coming in. The reason doctors are on a strike, same with nurses, same with teachers, same with others, right? But he's blaming doctors. The reason they have gone on strike is because they were getting real terms pay cuts after the banking crisis. Okay, they didn't go on strike then because that is sort of accepted. That, okay, we're going to have a couple of tight years, but then we expect it to go up again. But it never did. Their pay remained, they were getting real terms pay cuts year on year for 15 years. And then obviously now we hit the next inflationary period. It's really tight for them, to the point where junior doctors are getting paid less than people working in a coffee in Costa coffee shops, right? That's why, and Sunak knew that. He knew that. So if he was thinking that the strikes wouldn't have happened, then he's an idiot and he shouldn't be in charge, right? So he knew he was creating the circumstances for the strikes. So he doesn't get to blame the strikes. And the other reason he doesn't get to blame the strikes is because all of this chart goes up to 2021. Right? I haven't chosen it for that reason. That's just what's still on the Nuffield Trust website. But the point is, this is before any strikes. These waiting lists were going up and up before any strikes, before any inflationary pressures. This was before COVID hit, before the war in Ukraine. Okay, 2021 was after it. So that big sharp increase, yes, that was partly COVID. Although again, it went up more sharply because the NHS had been underfunded for 10 years prior and therefore wasn't fit to cope. Oh, Gary Arnold, thank you very much. Super chat. Says, I'm surprised they haven't tried to cook the books. They can't actually do that because there's too many independent bodies scrutinising them. but they do fiddle it wherever they can. So what I'm surprised is that they kept the waiting list defined. Look, Labour changed the definition of waiting list several times, but they changed it in order to apply stronger standards, right? They changed it to include more patients. Why didn't the Tories just change it to include fewer patients so it make it look like the waiting list had gone down? Why didn't they fiddle it that way? They could have done. Because I'll tell you something, the reason Labour kept including more and more people in the NHS system was so that they could, because they wanted to bring it down. They didn't want to play a statistical fiddle. They wanted to do it. And they had targets. The reason they came down is because they gave the people who manage NHS resources targets, and they kept making those targets harder and harder, right? But it kept working. The Tories then had those targets, failed to meet them. So do you know what David Cameron did? Changed the targets. He made the targets easier to meet. Then they failed those. So then he made it easier again. Then they got rid of the targets altogether. This was in David Cameron's time. So there aren't any actual waiting list targets anymore because the government got rid of them because they kept failing them. A couple of comments here. Justin saying they need to manufacture crisis to bring in their authoritarian laws against strikes, protest immigrants, people with disabilities, etc. Well, they already have. They already have done that, but it's not working because they know where the NHS in particular is concerned, the public are on their side. You know, there was a recent poll. In fact, there was a poll published yesterday, which I shall be doing a video on my own channel later today. Was going to be at noon, but then something else happened, so it'll be later today. And it says how much of the population think that the government are doing well or badly on various policy issues. On the NHS, and the sampling, by the way, was the 29th and 31st of July, so it's very recent, a few days ago. On the NHS, 14% think the government's handling it well. That is against 82% thinking badly. So the government are not fooling anyone with this. Rishi Sunak's trying to blame doctors and nurses. The public are not, right? The public are not. Stephen Barclay, Stephen Barclay is the health secretary. Do you know that? It's quite hard to know that because he's never actually out and about. You don't. When was the last time you saw a big front page news spread with the health secretary, Stephen Barclay, announcing something, some initiative for the NHS? He's like, I sometimes keep forgetting he's the health secretary. Like when Sajid Javid was the health secretary, I knew about it. Granted, he was the health secretary during the pandemic. Matt Hancock, I knew he was the health secretary. Jeremy Hunt, I knew he was the health secretary. I didn't like any of them and what they were doing with the NHS, but you knew they were the health secretary because they were always in the news, even before the pandemic. Stephen Barclay's never in the news. He's like, except when it's related to strikes. But he's nowhere to be seen. He's invisible. Where are all the if Rishi Sunak's got this plan to bring NHS waiting lists down, where's Stephen Barclay promoting it? Where's the news on it? Why can't we hear about these plans? What is the plan? Don't know, do we? The plan is for doctors to accept their pay cuts and get back to work. But this, again, misunderstands the whole problem. The pay cuts they're not just upsetting for doctors. It means we can't recruit doctors. There are adverts in Ireland for doctors paying way more than the UK pays. So because we don't have enough doctors in this country, let's face facts, right? And also, if you are in this country, if you're British, if you've got a British passport, well, you're allowed to go and work in Ireland anyway. It's the one part the EU are actually allowed to go to. It's the one part we still have some freedom of movement. But let's say you're a foreign doctor, because we need more foreign doctors. We just don't have enough in this country. And you're thinking of going, you go, well, I speak English. I can speak English. So we might go to Britain. And then you go, but they speak English in Ireland as well. And they're paying more in Ireland. Also, their government doesn't seem to be a circus. So where are you going to go? I actually don't understand how we attract any doctors in this country, quite frankly. Johnny Copperhead, thank you very much. £2 super chat. Barclay's had enough of being rinsed live on TV, I dare say. But he's not even presenting news in the Tory client media who will go easy on him. He's doing nothing. If you ask me, What is Rishi Sunak doing as health secretary? I don't know. I can answer the question of lots of other secretaries of state. I might not like what they're doing, but I can say what they're doing. I genuinely, if someone told me that Stephen Barclay doesn't even go into work, that he just puts his feet up every day, I would go, okay, I can't disprove that. I cannot actually disprove it. I might not believe it, but I can't disprove it because I don't know what he's doing. There's no evidence he's doing anything. Simon saying, A&E, it took me 11 hours for a minor injury. Well, that was your mistake, you see. You had a minor injury, yeah. You will be waiting for a minor injury. Depends when you go, to be fair. Last time I went to A&E, I was seeing quite quickly, but that was because it was like in the daytime, lots of, you know, but the time before that, it was 5 hours for what could have been quite serious. Thankfully, it wasn't in the end. It was just an infection, but it could have been. Yeah. And I've sometimes been in A&E before with someone else where it's been, you know, you've gone in at like 7 p.m. and it's been 4 a.m. before we were discharged, like for something that didn't require inpatients, like, you know, that was something that we could be discharged for. It just took that long to be seen. Barclay can't defend the indefensible. Well, what sort of Tory minister is he then? The rest of them give it a go, don't they? Oh dear. Jamie saying Stephen Barclay is my MP and he's very active locally. I keep trolling his pages for not tending to his ministerial duties. I think he's full in need to win the seat against the National League. Well, that's interesting, isn't it? Because yes, there will be. See, I spoke earlier. I'd read a report. So there's supposed to be a reshuffle happening at some point later this year, in autumn maybe. Rishi Sunak's supposed to be having a reshuffle. I don't know whether he is or not. It's been suggested that some ministers want to be shuffled out of the government. They don't want to be ministers because they're worried about their own seats and they'd rather spend the time locally in their local constituencies, drumming up support. So interesting if that is why Stephen Barclay's nowhere to be seen. But there we go. Because yes, there will be some MPs who, because it is a balancing act when you're a minister, whether a cabinet minister or a junior minister, between your job in your constituency as an MP and your job for the government as a minister, which in theory is a full-time job in itself. Ian saying, now, Phil, you're talking as if these ministers should be subject to some form of accountability. Well, that's the problem, isn't it? And whenever you suggest this to them, they go, well, we're accountable at the ballot box. People have the choice to get rid of us. It's like, well, no, they don't. Because if you're in a very safe seat, for whichever party, doesn't matter, if you're in a very safe seat, they're not accountable to anyone. They're just going to win. I mean, I'll be honest. If there was a Labour MP, if I was living in the constituency of a Labour MP, and let's say we had a Labour government, and this Labour MP were a minister, and let's say they were a proper idiot. They were only in their position because they were very influential, shall we say. But they were a proper Burke, you know, really doing a very bad job. I'd still vote for them because I'll still vote Labour. Let's be honest. So no, the accountability for, and the thing is, you're not voted to a government position. You can say you're accountable as an MP at the ballot box, but not as a minister, because no one votes for a minister. The Prime Minister appoints them. That's it. So in actual fact, there needs to be proper independent accountability. But there we go. Jim Jam saying, my 85-year-old nan had a shell full, oh my God, shell full, has split her shin open, was waiting nearly 10 hours in A&E. Well, that's, I mean, something like that is absolutely ridiculous. I mean, there was a time when for something minor, you could even go in on a Saturday night and you might be waiting a couple of hours. I remember when you might wait a couple of hours because it was minor. But, you know, something like this, 10 hours for something that can be quite serious. John Hart, £2 super chat, thank you very much. Says, Greenpeace have covered Sunak's house in black. Have they? Have they? I'm not actually, I have to say, I'm not actually in favour of like assaults on people because remember there's children and stuff like that in that house. But people do need to organise, I think, more robust protests against the actual ministers, even ones who hide. Why does the morning brew banner look all grubby around the edges like it needs a clean? I think it's supposed to be dissolving or something. You'll have to ask Graham. He did it. I think the Monty Python "What have the Romans ever done for us" sketch will be different as "What have the Tories ever done for us." It would be very different because there would just be silence. Absolute silence. NHS chats focus on stats. The actual personal experience of using the NHS is palpably different now. Aspirations lowered across the board. Staff seem to act as service blockers. Budget, health, attitude. Well, but that's what it is. You've got people who are managing the budgets, but they're managing budgets which are simply not enough. And yet it's their job to manage the budgets. They have to do that. That is their job. There's no point in complaining about them. They're just doing their job. And they're not given enough. So inevitably you have to do that. We there's the same thing with it's the same in every public service as well. You're just having to do things on a shoestring now, which ultimately means you can't, the focus is not on the service. The focus is on the pretense of a service. But it's not working. 14% think the government are handling the NHS well. 14%, that's pretty much their flaw in terms of the base level of tribal support they can always rely on. Phil saying, as a radiographer who works in A&E, it's blooming relentless. Just not enough of us. Patients getting frustrated, rightly so, but getting much harder to deal with personally. Well, see, this is the thing I tried to explain over the past few years with nurses, but it applies to every team. So if the pay isn't competitive, so you've got a situation where the pay is less and less competitive, particularly when you can get work anywhere else for more, and the conditions are worse, so people leave the service, right? And you can't just replace them. It's not like, oh, leave then, we can easily get someone to replace you. No, they can't. So then the team's smaller, but the demand hasn't gone down. So the supply goes down, but the demand hasn't gone down. So you're now putting more work on the people who remain. So the conditions get worse, but the pay's not getting any better. And that's what doctors and nurses and paramedics and radiographers are all making the point of with the strikes. We need the higher pay, not just so that we can maintain our standard of living, so that we can get some more colleagues to actually handle the workload. Because, right, Rishi Sunak, coming back to Rishi Sunak's why he can't get waiting lists down, well, it's because the doctor's on strike. So what you're saying is the fact that a doctor isn't doing that job is keeping the waiting list high. Yeah. So what about the doctors who are never in work? Like, he's having a pop at doctors who are withdrawing their labour for a few days. Well, what about the doctors who've removed their labour permanently because they won't work for the NHS because it's not paying as much as other, like the Irish Health Service, for example? How come that he's not worried about that? That is what's keeping waiting lists down, not the doctors who are withdrawing their labour for a few days to make a point, the ones who have permanently withdrawn their labour because we're not paying them enough. Phil saying, walk-in clinics were brilliant for minor stuff until the Tories shut them down. Yeah, I think there's still the odd one about, but there's one, we'd have to travel a bit, but there is one, after we have to travel a bit everywhere, actually, where I am. But there's, you can, it's about 40 minutes drive away there is. So there's the odd one dotted about. But yeah, for people who aren't exactly mobile or don't know about them. Richard saying, went in with mother-in-law with breathing difficulties, triaged 4 hours, wait for doctors, 8 hours. We left at 5 a.m, admitted 8 a.m. Lots of police looking after mental health crisis for hours. But, well, that's it. The other public services are just told, well, you'll have to deal with it. You'll have to deal with it. I mean, one of the things that Labour are going to introduce is a national social care service. So we've got the National Health Service. So, I've said this before, and I keep pointing it out. What happened when Theresa May was Prime Minister? What happened was she took a load of the social care budget, right? She took it. Then she made it smaller. Then she gave it to the NHS and said, right, the NHS is dealing with all that now. So the NHS as well as not being able to cope with its existing workload, was suddenly told it was going to be dealing with a load of extra social care issues with a smaller budget. Oh, you can manage with a smaller budget. You're marvellous. So, whereas Labour are going to say, no, we're going to have a national health service and we're going to have a national social care service as well. To completely separate them, to say that we need a public service specifically for social care. So we don't lump all these jobs on health workers, police, teachers as well. Teachers get a lot of social, since the Tories have been in power, I've been working as a teacher. Increasingly, teachers have had to do a lot of this social care work, which we're not qualified for. We have when I was working as a teacher under the Tories, every year you'd have a couple of hour training session on it, each year to highlight some issues. So you're basically supposed to be on the lookout for certain issues. And it's okay, you might, but we're not really properly qualified for it. Blaze is saying, Blaze rather, sorry, 31 Blaze. Loads of the consultants I worked with moonlighted at private hospitals to bump their pay up. Made me worry how alert they were for the normal job. Yes, there can be a bit of that as well. I mean, I remember when the pay for, because there were, when we talk about real terms pay cuts, we don't just mean pay rises that were a little bit below inflation. As a teacher, for example, I remember there were several years of pay freezes, which meant whatever inflation was that year, that was your pay cut, because you got zero, the salary was just staying the same, which meant in real terms going down. And I used to joke with my colleagues, I was the only person in the whole college getting a pay rise, because I was doing monetized YouTube content on a different channel from 2015. So, when the pay freezes were in, after the coalition government ended, I was actually still getting money to compensate effectively, but that was by doing YouTube stuff. Azalith, not seeking to blame staff for Tory cuts, but I also think the neoliberal attitude to focus on money calculations has been internalised culture in the NHS, often tendency not to intervene. Again, I'm going to have to keep pointing out, people keep using this term neoliberal really spuriously. That's not a neoliberal attitude. Someone who's managing a budget has to focus on money calculations. They have to make sure, because if the money, the Simpsons episode years and years ago, the Simpsons episode where Homer Simpson took charge of sanitation, like the bin lorries and stuff, and he blew the budget straight away. So then he had no money to pay. You can't do the same thing. You're given a budget, right? You've got a budget. You can't behave like a spoiled 18-year-old girl with a billionaire daddy. I've spent my allowance, daddy. May I have some more, please? That doesn't work. You've got your budget. You've got to make it. So the people managing that budget have to be focused on that. It's the government's job to make sure that they've got enough money to meet the priorities of the government. So the government set the priorities and the budget, right? And it is then down. So you can't blame the people who are focused on making sure the budget matches their expenditure, because they have to. That is their job. If they do not do that, they will lose that job and they will be replaced by someone who will do that. That is what they're employed for. And the government also have to have a certain attitude, because they've, Labour have to commit, for example, to make sure that they balance the books as well. So there has to be this focus because the public demand it. Would it be nice if the public understood economics a bit better? Yes, it would, but they have to. They demand this, so we have to provide it. But what we don't have to provide is waste by giving a load of money to people who donated a few quid to the Tory party. What we can do instead is say, no, we need to manage as much as we can in-house so that we're not paying public money into private profits. Ned saying there, another issue is Brexit's weakened the value of the pound, effectively making pay in the UK lower than other countries. Yes, that is also a very good point indeed. Brexit is very much on the news again today because the government have delayed their standards controls again, which has caused a hasty rescheduling of my videos today. But never mind, I got up nice and early. I've read stories where teachers have taken in washing from poorer pupils. I'll tell you one thing that I worry about. So I know as a teacher, myself and other colleagues, of some, because as a teacher you become quite acutely aware of poverty in your community, because if a kid is clearly, you know, if their family's really struggling, you sort of know about it as a teacher, right? So you've had situations where teachers and schools have actually, you know, identified these and sort of tried to contact the families and help out, stuff like that. I'll bet that's not happening as much, because as teachers themselves, particularly junior teachers, have struggled, you know, struggling with bills themselves. It's the same thing with like food banks. It's like there's more people needing food banks now, but there'll be some of the people who would have donated will no longer be able to. So you imagine it'll be more of a struggle for food banks to get the donations they need, because some of the people who used to donate, because they've got some, you know, sense of what it's like to have nothing, are now not able to. And I think the same thing with teachers as well. You know, teachers would often supply, you know, pay for things themselves, whether it be school supplies because the school budget doesn't cover enough stuff, so you as a teacher buy something, or, you know, helping out students who are clearly struggling or can't afford food sometimes. You know, that's happened. I've known that happen in my career while the Tories have been in power. Funnily enough, never seemed to be an issue, because if ever you identified, and you did sometimes identify students who were clearly in poverty when Labour in power, but there was always someone to refer them to, and it would be sorted. You didn't feel you had to take care of it yourself. But there you go. What has privatisation done for 90% of the population? Given them higher bills and poorer service. Really simple. But there we go. We'll do the last one because we're running out of time. It says, why have Labour not committed to revoking hundreds of new oil drilling licences announced by Sunak? Surely not revoking licences would completely destroy Labour's green commitments. Very frustrated. Now, you again, their commitment is not to grant new licences. If the Tories want to issue those ones, you don't change your policy for that. The reason existing policy, they've already got a lot of unions whining about it because they're worried about the jobs. Labour are trying to say, no, you're missing the picture. We're going to create lots of new green jobs. But unions, until they see it, aren't convinced, right? So there's already union unease about Labour's current position. If Labour were to suddenly say that they're going to revoke a load of these licences, then there's quite a lot of affiliated unions would go apeshit. That's not helpful. Second thing that would happen is the Tory media would say Labour have now destroyed X number of tens of thousands of jobs. So they'd get a lot of bad press for it as well. So Labour can't do that. Now, that's not to say that they can't revoke them when they're in power later on, but they can't announce it. I'm not suggesting they will. They can't announce it now because what they cannot be seen to be doing is destroying jobs, right? Particularly well-paid jobs. Politically, be suicide for them. Can't do it. Can't be done. You've got to be politically realistic. Otherwise, you just don't win power. It's like, you know, there's various things. I know people will say on lots of policy areas, whether it be this or Brexit or privatisation or whatever. And some people say, oh, isn't it really annoying that Labour or the Lib Dems sometimes even won't say this or won't say that? And it's like, there's a choice. What do you want them to do? Do you want them to say something or do you want them to do something? Because sometimes it's not possible to do both. You can either say something or do something. And in this case, Labour are deciding they want to do something. So, you know, we will default to judging them when they are actually in power. But politically, you can't be falling into Tory traps. But anyway, thank you very much for coming on. Don't forget to click the like button and the subscribe button. There'll be details about Patreon below if you're interested in joining the channel further. Have a very good day, everyone. And until next time, I'll see you later.